Welcome to The Explainer. Today we've got a real scientific showdown for you. We're looking at PCOS treatment, and we're putting three really popular options head to head. The big question is, will one come out on top?
You know, for the millions of women dealing with Polycystic Ovary Syndrome or PCOS, finding what works can feel like a super confusing journey. With so many different options floating around, you have to wonder, is there really a one-size-fits-all answer?
All right, so first, let's really get a handle on the challenge itself. What makes treating PCOS so darn complex in the first place?
Well, PCOS isn't just one thing. It's this really complex endocrine disorder, and it can show up in so many different ways. We're talking irregular menstruation, fertility struggles, but also serious metabolic stuff like excess insulin, abnormal blood fats, and obesity. It's this huge spectrum of symptoms that makes finding the right treatment so tricky.
So to try and bring some clarity to all this, a recent clinical trial decided to put three popular treatments to the test, right up against each other. So let's meet our contenders.
First up in the ring, we have Metformin. You could call this one the long-standing champion. It's an oral anti-diabetic drug, and it's been the go-to first-line therapy for PCOS for years, mostly because of how it helps with blood sugar and insulin resistance.
In the next corner, we've got Berberine. Now, this is a plant-based compound from an herb extract, and researchers are super interested in it for improving insulin sensitivity, but as we're about to see, it also has some pretty impressive effects on things like body composition and cholesterol, so think of it as a cardiovascular specialist.
And our final contender is myo-inositol. This is a naturally occurring substance. It's actually part of the vitamin B family, and it plays a huge role as a messenger for insulin inside our cells. That makes it a really promising option for tackling insulin resistance right at the source. Okay, we've met the contenders. Now it's time for the main event, the results. After a 3-month clinical trial, how did these three actually stack up? Let's find out.
Let's kick things off with insulin sensitivity. On this chart, we're looking at fasting insulin levels, and the goal here is to get that number as low as possible. And, wow, there is a clear winner here. Myo-inositol absolutely crushed it, leading to a much bigger reduction than both Metformin and Berberine.
But when we switch gears and look at cardiovascular risk, the plot thickens a little bit. Now, this chart shows that Metformin led to the smallest waist circumference. But the study looked at the whole picture. When you factor in other really important things like cholesterol and your overall lipid profile, the researchers concluded that Berberine actually showed the greatest overall potential for reducing those long-term heart health risks.
This table really sums it all up perfectly. The big takeaway? There's no single champion. It's more like each one is a specialist. Myo-inositol is your go-to for insulin sensitivity. Berberine is the star when it comes to body composition and lipid profiles. And Metformin? It was the best for boosting something called SHBG, which is super important for managing those excess androgens. See? Each one has its own superpower.
This brings us to a really important point about inositol. We just saw that myo-inositol is fantastic for insulin sensitivity. But what if the main goal is fertility? What if it's all about restoring ovulation? Well, it turns out there's another layer to this story that we absolutely need to dig into.
To get that answer, we've got to look at a different study, one that uncovered a kind of secret formula. It turns out, when it comes to fertility, the specific type and ratio of inositol is everything.
This chart is the key. It's tracking progesterone, which is the hormone that confirms ovulation happened. Researchers tested 7 different formulas. And if you just follow the peaks of those darkest bars, which show the 3-month results, you'll see one specific ratio consistently produce the highest levels, time and time again. And there it is. That's the secret formula, a 40-to-1 ratio of myo-inositol to another form, D-chiro-inositol. That was the magic combination for effectively restoring ovulation in women with PCOS.
So what in the world does all of this mean for you or for someone trying to navigate their PCOS treatment? Why does any of this matter? Let's put all the pieces together.
So here it is. The biggest thing to remember from all this research is that there is no single winner. The best treatment option is not one size fits all. It totally depends on your specific symptoms and your personal health goals. If insulin resistance is your main battle, myo-inositol looks like a really strong contender. If you're more concerned about cardiovascular risk, Berberine seems to have an edge. And if restoring ovulation is the #1 priority, the science points directly to that specific 40-to-1 inositol ratio.
Now, of course, this explainer is just for informational purposes. It's definitely not medical advice.
But the goal here is to arm you with the knowledge to have a more specific, more informed conversation with your doctor. Because understanding the science behind your options, well, that's the first and most powerful step toward finding the personalized approach that's just right for you.